The last 5 years, since 2017, Arkansas has lost more than 2,300 people to a drug overdose. 2,300. Let that number sink in and know that that is somebody's son, sister, or best friend. Well, a new program launched today hopes to stop that devastating number from climbing any higher. THV 11's Mercedes McKay shows us how this new program will work.
We're going to need to have everyone talking about this, everyone aware of this, everyone empowered and not afraid to use what is as simple as a nasal spray that can save a life.
An urgent plea from health officials in Arkansas to help with a problem that affects every community.
Our state had one of the highest opioid prescription rates, so we do have many people that have an addiction.
That number continues to rise with the impact of COVID-19 and the increased use of illicit fentanyl.
With that, it made a perfect storm for our overdoses to increase, and since 2019 we're almost going to double the amount of overdose deaths we had in our state.
The devastating numbers are why the Arkansas Center for Health Improvement partnered with the state drug director and the Arkansas Department of Human Services. The group's announcing on Tuesday that Unity Health in Searcy is the first hospital to launch the program called NaloxHome.
It's a hero starter kit. It allows somebody to breathe during an opioid overdose, which is so important nowadays.
Dr. Joe Thompson with ACI says the program allows the hospital to send free naloxone, commonly known as Narcan, home with patients who have experienced an overdose or are at risk for one.
Hopefully we're able to save individuals when they do overdose, but it gives people the power, the families, the opportunity to have something at home should that individual have another overdose in the future.
With research showing that many patients who are treated for an overdose in emergency rooms have a high risk of relapsing, state leaders are hopeful this could change the narrative.
We can really make a difference and save people's lives.
This isn't going to be the only hospital in the state to have this program. Dr. Thompson says in the future they will be expanding it to hospitals across Arkansas. In Searcy, Mercedes McKay, THV 11 News.
There is a money question here. The funding for this project will last until 2023, but ACHI says they'll be working with policymakers to hopefully make the program permanent across the state. And it's also important to know that Narcan is just the first step in being treated for an overdose, and that a visit to the ER should come immediately after.